This is NDTV. And you're watching NDTV 24/7.
You're watching Living with COVID. I'm Rishika Barwa. In this very special show, we're joined by some of the top medical experts to help us navigate through living in a pandemic. Most of us are back to offices, back to routine work, and as we grapple with the new normal, there are several small and big questions that continue to dominate our everyday discourse. We're joined by Dr. Puneet Saxena, consultant endocrinologist. We also have Dr. Mishra, an interventional cardiologist with us on the broadcast. Thank you so much, doctors, for sparing the time of day. Well, I want to begin by asking, what is the difference between an endemic like influenza, a pandemic like COVID-19? What are your views, doctor? If I could begin by asking Dr. Mishra.
Endemic is a condition or a disease which is regularly seen in a particular population or in a definite place. Whereas pandemic is a disease or a condition which is seen throughout one country or beyond one country, maybe the whole world. So this is the difference between pandemic and endemic.
All right. So that's, I think, very fundamental difference there between what the world saw during influenza and what's happening really during the COVID-19 pandemic. Dr. Saxena, what are the kind of hygiene and safety protocols that you're following for your staff? I'm asking this because there are people who are very concerned about going back to hospitals or clinics, for other checkups.
Yeah, this is a very appropriate question actually, because the hospital staff, including the doctors, they are in routine touch with all sort of patients, whether it's called COVID positive or negative. So the proper hygiene of the hospital staff has to be maintained so as they don't become the spreaders of the disease. They can become carriers, they can become infected, and then they can spread the disease to the patients also. And patients are very much worried. That's why they are not accessing the clinics and hospitals in time, that they are worried that they will get infection from the hospital itself. So the proper hygiene is use of personal protection equipments, including the masks, and wherever it is indicated, then use of N95 mask also where the high risk areas, and use of windshields basically to cover the face and the nose and the oral cavity, gloves, use of sanitization, and wherever required, say sample collection and other things, then personal protection equipment, the full PPE kit is also being used for the hospital staff.
All right. So those are, of course, some of the measures that are being followed. But Dr. Mishra, if I can bring you into the conversation and, specifically ask you about cardiac patients and what are the different ways in which cardiac patients can mitigate their risks or reduce their risk of, contracting COVID-19.
Cardiac patients are more prone to have COVID-19 like other patients with comorbid like cancer, diabetes and hypertension. The most important thing is the mortality is also high among patients of heart disease suffering from COVID-19. So what we should suggest is those patients should avoid to go out to public places as far as possible. If at all they go out, they should use a mask, maintain social distance, and once they come back to their home, they should wash their hands and feet and take a bath if possible. Another important thing is these patients should take their heart cardiac medications regularly, and because it has been seen that during the lockdown period, there was paucity in the availability of drugs. Hence, people have discontinued their medications. They should not discontinue the medicines.
All right. I think, that's very important advice for heart patients. Dr. Saxena, if I can come back to you, when it comes to patients who are suffering from diabetes or hypertension, these are patients with comorbidities. They're asked to be extra careful. Would you recommend a COVID test for hypertension and diabetes patients? And what test would be appropriate for them?
It's a very appropriate question that they are high risk people, diabetes and hypertensives. But see here that you cannot test all the diabetics and hypertensives. So those who fall into the definite criteria, those who have been exposed, those who have come into contact, or those who are showing symptoms, so they can be tested. Otherwise, it is just not possible to test because we have a huge population of diabetics and hypertensive in our country also. And if they are maintaining their proper hygiene and distancing and isolation, so the chances of getting them exposed is not very high. And regarding the test, the RT-PCR test, which tests for the viral particle in the throat and the nasal cavity, is the gold standard test, and we are recommending RT-PCR test as of now.
Right. But obviously, Dr. Saxena, even for hypertension and diabetes patients, those tests can only be done if you've either come in contact with a COVID case or in fact you develop symptoms, right?
Exactly, because we have very high numbers of diabetics in our country, and as a prophylactic, we cannot do tests on everybody.
All right, so that's important to note. However, also, for a patient with diabetes and heart diseases, what will you advise as a follow-up protocol? When should they be doing teleconsulting? When should they visit a clinic, especially looking at the point that they are at a higher risk of the infection, Dr. Mishra?
Patients with diabetes and heart disease, especially the chronic patients, should not come to the doctor's chamber for consultation. They should consult by telemedicine, by virtual consultation, because if they don't have any symptom, it is better they continue the medicine and not to visit the hospital or doctor's chambers, because now we find that the doctor's chambers and hospitals have become hotspot. If at all they have serious symptoms or serious problems, then only they should come to the doctor's chamber with adequate precautions.
All right, Dr. Saxena, what are the kind of levels or medical parameters that should be monitored very closely, especially by a diabetic patient, and how frequently should these readings be taken down? How frequently should they be shared with a doctor?
Yeah, good diabetes control is the key to avoid the infections and to avoid any other complication of diabetes. So they are advised that they should be testing their blood glucose at homes by using different devices like glucometers, and they should be informing their doctors if the readings are not well within the range. So it depends on patient to patient that if suppose somebody is type 1 diabetes and he is on insulin, then intensive monitoring of blood glucose is required. Those who are high risk or those who are having comorbid illnesses like heart disease or stroke or kidney disease, they again need to monitor their sugar more intensely as compared to the patients who are stable, who are young, who don't have any complications, and who in generally have good glycemic controls. And patients are advised to share their readings via teleconsultation with their doctors, and if there is a real need, then only they should visit the clinics.
Right, but Dr. Saxena, I'll ask you the same question. At what point can you ascertain whether a teleconsult is enough or whether you should actually go in for a physical exam? What are some of the telltale signs that patients should be watching out for?
If somebody is showing symptoms of COVID, I'm speaking in context of COVID. So symptoms of COVID, fever with sore throat, cough, body aches, severe fatigue, typical symptoms associated with fever like loose motions, vomiting, and severe prostration. So then obviously one need to consult the doctor. And besides this, if somebody is having deterioration in diabetes, suppose the sugar levels are going very high, and there are symptoms of polyuria or polydipsia, or any other problem like chest pain or pain abdomen or vertigo. So any kind of symptoms or signs, they should be addressed. And in context of COVID, the febrile symptoms, that is fever, along with cardinal symptoms of COVID like cough, sore throat, fatigue, they should be brought to the notice of doctors immediately, and consultation is required.
All right. So I think, those are some of the telltale signs that one should really be watching out for. We're going to slip into a very short break, but Dr. Saxena and Dr. Mishra are going to continue to be live with us on the other side. So do stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Amity University has India's largest scholarship program, from which over 25,000 brilliant students have already benefited. Students with over 93% in Class 12 boards get 100% scholarship, and students with over 90% get 50% scholarship. Join brilliant, like-minded students who want to be successful. Apply at amity.edu/scholarships.
इतना सब कुछ होने पर भी अपना हेल्थ इंश्योरेंस नहीं कराओगे? आज ही सही डिसीजन लो। मैक्स कूपा हेल्थ इंश्योरेंस के साथ 30 लाख तक का कवरेज सिर्फ 620 रुपीस पर मंथ में। अब नहीं खरीदोगे तो कब?
As we battle the coronavirus, access to safe and hygienic food has become paramount. How can the food packaging and processing industry ensure that everyone, everywhere can trust the food they consume? How can we ensure food safety from the farm to the table? Watch experts dive into the issue on We the People this Sunday at 9:30 p.m. only on NDTV 24/7. The Sikh tradition of langar is about ensuring food for the hungry. No matter who you are welcome with open arms at the Guru ka langar.
इन्होंने शुक्रगुजार है मालिक का जो इन्होंने इतना साथ दिए।
लंगर का मैं वाहिगुरु का प्रसाद है,
डेली बांट रहे हैं। इनकी मेहरबानी, भगवान भला करे इनको।
Watch a special show on how the Gurudwaras have fed over 1.5 crore people during the pandemic. Dil Se Seva, feeding millions, Saturday at 11:30 a.m. and Sunday at 7:30 p.m. only on NDTV 24/7.
Namaskar, this is Amitabh Bachchan. The joy of holding a healthy baby, the smile of a mother looking into the face of a child for the very first time, the first steps a child takes, her smile, the first word she speaks. These are the simple and profound joys of the first 1,000 days. If she and her mother don't get the care and nutrition they deserve, none of that will be possible. The first 1,000 days, remember, that will define a lifetime of wellness. Come and join us on our journey to ensure a clean and healthy India. An India where our most vulnerable get the best opportunities to become our strongest. Banega Swasth India.
अब पापा का पेंडिंग बर्थडे गिफ्ट भी मिलेगा और जुम्बा क्लास के लिए नए जूते भी, क्योंकि अपनी दुकान में मिलेंगे आपकी जरूरतों के सारे सामान पूरी हिफाजत के साथ। बताइए क्या चाहिए? Amazon, आपकी अपनी दुकान।
Let your little light shine. Let your little light shine for the world to see.
Welcome back. Both our doctors continue to be live with us, Dr. Saxena and Dr. Mishra. As the country reopens, as people, get back to adapting to a new kind of normal. Dr. Mishra, if I could ask you, this is a question that plays on a lot of people's mind. How safe is it to be visiting elderly parents who stay alone? Is it safe to make contact with them? And what are the kind of precautions that one should take, whether it's visiting an elderly parent or even coming home, to an elderly parent?
It's a good question. Nowadays, most of the parents are staying in a separate home, in their villages or in the cities, and the children work in different places. So if at all the children want to visit their lonely parents staying alone in cities or villages, they should not visit them if they have symptoms suggestive of COVID, like cough, cold, sore throat, fever, etc. And if at all they want to visit them, they should put on a mask, and once they reach their parents, they should take out their shoes outside the home, wash their feet and hands, and meet them. They should avoid touching the feet of the parents. They should not hug the parents, and they should maintain a social distance. And they should try to stay as little as possible. Once the point is, they should not stay for a long period of time with them. So that is how they can mitigate the risk of infecting their parents.
All right, Dr. Saxena, would you like to add anything? I think this is a very common question. A lot of doubt that people have going back home to elderly parents, and what are the kind of rules and regulations that you should follow, whether you should make contact, shouldn't make contact. Is there anything you'd like to add?
So after lifting of lockdowns, we have seen migration and travel. And we have seen that because of that, the COVID has spread across the boundaries, cities and states. So one should be very cautious, because whosoever is traveling, especially the children to meet their parents, the parents are basically their elderly people. And they must be having some or the other comorbid illnesses like diabetes, hypertension, or any asthma or cardiac disease. So you are putting them to risk. So as Dr. Mishra has just said, that you should be symptom free first, and second, even if you are symptom free and visiting your parents, then take adequate measures.
Right.
Use personal protection equipments, especially mask, sanitization, and maintain adequate distance from your parents.
All right. So maintaining adequate distance, I think, is key. And of course, continue to sanitize, wash your hands, and wear a mask preferably, and meet them from a safe distance. I think that's what both doctors really agree upon. But Dr. Saxena, if I could also ask you a follow-up question, because, now, as of course, India unlocks, as we, learn to live with this new normal, travel, is something that is unavoidable for a lot of people. They have to, travel for work or to say visit, elderly parents or for personal reasons. What are the kind of precautions that one should take while on an outstation travel? Dr. Saxena.
So travel should be taken only when it is necessary. If your job demands it, or if you have some compulsion to visit your parents or family or kids, then only one should travel. One. Two is that you are moving outside. You are exposed now to the other people. So use all the gadgets, like you can use specs, you can use mask, you can wear gloves, you can carry sanitizer with you. Avoid touching and getting in close proximity with the people. And take a route where the shortest possible travel is possible. If the travel is short, you can use your own car. So that is very safe. You are not exposed to anybody.
Right.
But if that is not possible, then take all the personal protection measures, whatever possible, and avoid eating food outside, avoid drinking water, use all the hygienic measures which are advised for a general family.
All right. Dr. Mishra, anything you'd like to add? As some people have to undertake travel for absolutely essential reasons. What are the kind of, precautions that you would recommend?
There are certain situations when there is an absolute necessity to travel, either by road or by train or by flight. But the best thing is, as Dr. Saxena has told, if it is a short distance travel, then you should use your personal vehicle. That is the safest. But if you are it's a long distance and where you have to travel by flight, again, as I have told, the ideal thing is to have a full PPE kit. And if you are not having a full PPE kit, then you should have a pair of gloves, you should have a face cover with a mask, with a face shield or a headgear. And when you get down from the airport, if somebody has come to receive you, you don't hug him, don't shake your hands with him, maintain a social distance, and travel from the airport to your home or to your destination by personal car, if at all it is possible.
Dr. Saxena, I think a lot of questions that people have, especially in terms of air travel. I know you've said that use your own vehicle if it is short distances, and if you can manage to drive your own vehicle and avoid contact, and that's something that you'd rather do. But what about people who absolutely have to board a flight or travel? What are some of the do's and don'ts for air travel?
So avoid taking a cab. And I think the majority of the cities, they have not allowed cab drivers also. So take a personal car to the airport, avoid mingling with the people there, and don't touch. Minimum touch technique is the best technique. Use sanitizers frequently. And the airlines have taken adequate measures where they are keeping the seats vacant also.
Right.
And just keep a watch that if somebody near you is not well, if he's sneezing or coughing, then maybe you can maintain a distance, you can move away, or you can report. And similarly, when you get down from your flight, so don't stay at the airport for long. Move out immediately and try to use a vehicle which may have maybe personalized for you.
Right.
So if you can get your own car or some of your relative, then it's much better.
All right. So as much as I think what you're also saying is, as much as you can avoid it, avoid using public transport, especially cabs. Try and use your own vehicles, and of course, flights have taken their own measures. But Dr. Mishra, we've seen as people have been flying, we've seen people wear helmets. We've seen some people even buy entire PPE kits in travel. Some people are using masks and face shields. What's the ideal scenario? What would you recommend that people should wear? And also in terms of personal protective equipment, what's enough, and what is it that people should be doing?
Though the ideal thing while traveling, if somebody can afford, is the PPE kit from head to toe. But short of that, one can put on a pair of gloves, put a mask, and put a face shield or headgear. And while traveling, they should try to maintain social distance as far as possible.
All right. So masks and face shields is ideally, something that people should be doing. Wearing a full PPE kit, well, that may be ideal, but not always possible and not always the most comfortable as well. I want to end, Dr. Mishra, by also asking you another question, and this is just going back to the issue of management of hypertension, because I think it's a question that a lot of our viewers also want answered. What's your view on the use of ARBs to manage hypertension in COVID-19 patients, Dr. Mishra?
The use of ARBs and ACE inhibitors in the management of hypertension in COVID situation, the controversy is settled now. See, the whole controversy started with one report from Italy, where they found, from a small number of cases, they found that patients who were taking ARB or ACE inhibitors for treatment of hypertension had a higher mortality in COVID-19 infection. But subsequently, 2 large trials have confirmed that this is not true. It is safe to use ARB and ACE inhibitors. If somebody is taking it, he should not stop it, and he should continue to take ARB and ACE inhibitors. So there is no confusion now as far as the use of ARBs and ACE inhibitors in the treatment of hypertension in the setting of COVID-19.
All right, Dr. Mishra and Dr. Saxena, thank you so much for joining us on the broadcast. You've been very patient in taking on, a lot of those very key questions. Thank you once again for your time.